All right, it's 1 o'clock. The show is What's Going On. I'm your host, Hugo Fernandez, and we're coming to you today at a special day, Tuesday. My guest today is Professor of the Health Sciences Department, Dr. Juline Koken, and Dr. Koken is on to talk about her work with Motivational Interviewing Project, which is in conjunction with the college's Project Conexión Title V grant from the U.S. Department of Education, which is a Hispanic Serving Institutions grant. Welcome, Dr. Koken.
Well, thank you so much. I'm really happy that I can come and talk about motivational interviewing and just share what we've been doing.
Yeah, and I'm going to give you a chance to explain what it is, because I did like the most minimum of research trying to find out about it when I was looking for something to start with, but I found James Taylor musical. So, but first, let's talk a little bit about you and your background. Tell us a little bit about yourself, like before LaGuardia, like your studies, where you're from, things like that.
Yeah, I was thinking about this. I think this was my third career being here. I am a former professional dancer. I used to be a ballerina when I was young, and then I went back to school and I earned my PhD, technically in social psychology, but I would describe myself as a health psychologist. So for many years, actually, before I came to LaGuardia, so this would be career number 2 after ballet, I was a full-time research scientist. That's why I wear the white coat, you know. And I still do research, but not nearly as much as I used to. I did HIV prevention research, substance use research, a lot of sexual health research, and research with queer people, trans folks, sex workers. So I had a lot of fun doing that work, and all of that is still kind of informing what I do here. And then I came to LaGuardia in 2014. It's gone fast.
Yes, it has. And I was going to say, what does a medical psychologist do? I mean, actually, my wife, believe it or not, is a psychotherapist, but she was a clinical social worker. So, I mean, I know her thing, which is the talk therapy kind of Freudian thing.
Yeah.
Her focus, by the way, happens to be, now what is it? Self-psychology. If that means anything to you. Yeah.
Of
course.
Course.
So what does a medical psychologist do?
Well, I would say health psychologist, not necessarily medical, but as a health. So public health is an interdisciplinary field, right? Within public health, there's psychologists, anthropologists, sociologists, historians, all kinds of people involved with public health. So as a health psychologist, the research and the type of work that I've done is invested in supporting both individual health as well as health on a kind of community-wide scale. So even today, I still do a little bit of research, but I also do a lot of community-based work where I'm supporting programs in hospitals and social service agencies that do things that promote public health. Again, a lot of HIV prevention work. So yeah, I would say that, and I am trained in counseling, but most of my work involves supporting programs both here at the college and across the city that promote personal well-being.
We're on a macro level as opposed to one-to-one.
Yeah, exactly. Yeah, and that partly goes back to my background as a social psychologist. So a social psychologist is a person who looks at the individual within the context of society. And so I often joke, this is a very discipline-specific joke, but the DSM is the list of all the mental disorders, the Diagnostic and Statistical Manual, and I always say, like, let's toss out the DSM and replace it with a list of social disorders, because everything that we are is, we are a product of our community and our background, and can't be separated from that. I don't think that there's any such thing as a personal or individual problem.
Right. My wife goes to the DSM whenever she's when she's dealing with the insurance companies. They need the number for those purposes.
Yes, that's right.
If she wants to get.
Yeah. Yeah, you have to give somebody a diagnosis.
I would be remiss if I didn't ask what happened with the ballet career.
My knee and my hip happened. I miss dancing, but it's very hard on the body. And so I returned to college at the age of 25. I went to Hunter College, and I majored in psychology. And I actually was thinking of going into social work. That was my plan at the time. And I unexpectedly fell in love with research, which I really never would have seen coming. Because when I think research, I think statistics. I've never been a big math person. I fell in love with what I now know is qualitative research, where you can interview people. And I just absolutely fell in love with the things that you can do with qualitative methods. I have great respect for my statistician colleagues. We work together. That's just not the end of research that I'm, in charge of.
So, you're working in the field. How do you find yourself applying and working at LaGuardia Community College? How did that happen?
As I said, I worked as a research scientist for many years, but I really loved teaching. I used to teach as an adjunct at Hunter, not because I needed the money or anything, but I just liked keeping my hand in the teaching field. And I was very selective about applying for faculty positions. I'm really quite fortunate. I only applied for a few faculty positions. I really didn't want to. I was happy in my job. I didn't really want to go anywhere unless it was somewhere that I wanted to go. But I heard about the position at LaGuardia through one of my colleagues, and I was very interested. And I'm so happy that I came because the students that we work with here, as you know, are just the most wonderful group of people to work with, and colleagues as well. So I love to do research, but I'm really happy that I made the jump over to the teaching side.
So, and I'm looking at my own description, which I wrote, which you signed off on. So in health sciences, what kind of classes do you find yourself teaching, and who are you directly under? Who's your chair? Is that Phil Gimber?
Yeah. So yeah, Phil Gimber's our department chair. And I'm now the program director for human services, mental health human services. So our program prepares students for a broad range of human service careers. It could be social work or counseling or public health, different types of things. Sorry, you asked me about what I teach. So I used to teach a lot more of the public health courses. Human sexuality, drugs and behavior, HIV/AIDS, community health. But for the last several years, I've been teaching the core human services courses, which I also designed. So I'm very proud of these courses. They're the required core coursework that all of our human service majors complete. So one course that I teach is interviewing and counseling, and that's actually where the students get trained in motivational interviewing as part of their class. And then there's a follow-up class called group interviewing and counseling, where MI is involved in that as well. And I also teach community organizing, which I absolutely love. I have a background myself in community organizing and advocacy many, many, many years before I came to LaGuardia. I used to actually be much more active as a community organizer. And I did a lot of sex work organizing. We're now talking about 20 years ago, even more than 20 years ago. So to have that background and to be able to kind of bring it to LaGuardia and to support our students in thinking about how they can be change agents in their communities is just incredibly rewarding and super, super, super fun.
So again, I guess I'm a little because I think when I think of Phil and the folks he works with, I think of the nursing program. Are your students nurses? Are they taking these classes, but they're nursing students?
So no, human services is a major, mental health human services. So yeah, the students in my classes, they're all human services majors. However, the grant that brought me to come here and talk with you today is to expand the training of motivational interviewing across the health science programming. So I personally won't be working with nursing students, but I'm supporting the faculty.
And is your program as selective as the nursing program? Because I know I get nursing students, and a lot of times I start class by asking students, so what do you want to get out of this class? And they'll say an A. And I have to explain to them how they get that A, like the kind of work they have to do or the work they have to do. But I know it's a very selective program, straight A students after the first year, and then in the second year they get into the nursing program where they have to do just as well. But for your program, is that the same expectations?
Well, it's a different kind of system. So in nursing, the graduates of the nursing program have to pass the NCLEX, the licensing exam. And if they didn't pass the NCLEX, then eventually the nursing program would become de-accredited. So there's a reason why the nursing program has to be that stringent. So in human services, the associates in human services is not a, what's the word I'm looking for? It's not a terminal degree. And most of our students will continue on to the four-year college. So there's no type of licensure exam or accreditation that will function in that way where we would need to push people out. So we don't have what's called a clinical phase where you have to apply to continue on. As long as you're a student in good standing and you continue to be motivated to pursue a career in human services, then you'll be retained until we graduate you.
Well, let's talk about, because you mentioned the grant, and when I did my introduction as well, I mentioned that this is the Project Conexión Title V grant, the U.S. Department of Education, and you were mentioning that this approach of what you call motivational interviewing project. I guess everybody calls it that. Maybe it might be a good time to explain what that is. What is a motivational interviewing project, or what is motivational interviewing?
Yeah, it's so motivational interviewing is a style of communication. And I'm using that phrase very deliberately, style of communication. And unfortunately, the title, motivational interviewing, can be sort of confusing because people either think, are you some type of motivational speaker? No. And they think of interviewing and they think, well, questions and answers. And actually a very skillful motivational interviewer doesn't ask that many questions. So it's a style of communication. It originated in addiction treatment. However, now it's used all across healthcare. It's used in education. It's used in social work, counseling. It's used by medical doctors and nurses. It's used in criminal justice. So any area where you are working with a person who could potentially benefit from making some type of change, we all know that change is very hard. And so motivational interviewing is a way of talking with a person that is very empathic and extremely respectful of that person's autonomy, of their right to make their own decisions for themselves. So it's the goal is that you support this person as they kind of consider their options, and then they make their own decision. So it's designed to increase a person's personal individual motivation to do some type of behavioral change because that's what they would like to do.
It's when I was watching online what the person was not supposed to do.
Yeah.
The character was doing, whoever I guess was playing the clinician, basically was giving the person, it was somebody, I think it had an alcohol problem, and giving them a hard time about, the amount of alcohol that they were drinking on a regular basis. Mm-hmm. And so what would have been the right way to do that with somebody?
Yeah.
Kind of model.
So I have been working in addiction treatment for many years, and we have now, and I've also been involved in addiction science research on what's effective for helping people with alcohol or substance problems. And so motivational interviewing is very effective for helping people in this way. But unfortunately, a lot of the traditional forms of alcohol and drug treatment are based in confronting someone, shaming them, you know, pathologizing them as being in denial, or, you know, you haven't hit rock bottom, and, you know, very confrontational. So motivational interviewing is completely the opposite of that. So if you're talking with somebody about their drinking, you're going to be very curious to want to understand more about what potential concerns they have about their own drinking, you know, kind of how they feel that drinking has impacted or shaped their own life, what kind of life they want to make for themselves. And I'm sort of modeling open questions right now, but what a really good MI person does is maybe ask one of those questions, listen to the answer, and then sort of selectively paraphrase back to the person. So as if you're holding up a mirror, and that person kind of looks at their own image in the mirror and thinks, okay, what am I seeing? And do I like what I'm seeing? Is this how I want to be? So again, it's very focused on a person's autonomy. That you make your own decisions about the life that you want to create for yourself. And nobody can force you to do something a different way. And usually trying to make somebody do something different is very, very unhelpful. You know, it drives people out of treatment settings. You know, people who work in public health know we have almost all major chronic health conditions have a foundation in personal behavior, whether it's the food that you eat, substances that you take into your body, like smoking cigarettes or drinking alcohol. You know, our day-to-day behaviors shape our health. And this way of talking with people is based in respect for, you know, you get to decide how you're going to, you know, do your day. What kind of, you know, how do you want to feel? You know, what kind of life do you want to make for yourself?
Does this put it in kind of conflict with other types of, well, let's say in this case, you know, addiction programs, like you kind of mentioned. I don't know if you refer to it 12-step programs where people find themselves, you know, sitting, listening to somebody else tell a story, and they identify, and then they have to you know, they have to go through this kind of rigorous process of reviewing their behavior and trying to affect change through the help of, you know, a power greater than themselves many times.
Yeah, there's no conflict with the 12 steps. It's just a different approach. There are places where motivational interviewing is used to help engage somebody in a treatment setting. And then once they enter treatment, they receive, you know, treatment, some other type of thing, whether it's cognitive behavioral therapy, or maybe they go to a 12-step if they want to do that. So there's no conflict with these other approaches. Motivational interviewing is often used in conjunction with other approaches, or as a way of sort of helping people get ready to change. And then once they're ready and they're kind of getting started, then they can transition into some other type of treatment or not. Again, like, this is really founded on respect for personal choice. And then I want to say, since we're talking about addiction treatment, that's still true even when we're talking about spaces where somebody has been mandated into a treatment program. So even if it kind of appears externally that this person, quote unquote, didn't have a choice, even in that setting, actually MI is even better, because even when somebody has been mandated into treatment, they did actually make a choice, because they're given a choice. You know, you can go into a treatment program or you can go spend some time in jail. Which would you prefer? You know, so they, even in that setting, it seems like you have no, you know, very few choices, but you do. And certainly once you're engaged in treatment, you have choices about how to proceed. So we're, especially for people who have been marginalized or have been, you know, kind of pushed around and had their choice taken away from them, then this approach is even better and even more effective, because it's focused on what options do you have and what would you like to do with those.
And so this approach, is this something that's kind of swept the the field, or is this something that
Mhm.
you found that you wanted to bring into your pedagogy?
Well, it's, as I said, it started in addiction treatment, but now it's used all over the place. And so motivational interviewing was developed in the early 1980s out of clinical practice. It was developed by a guy named Bill Miller, and he was interested in addiction treatment. That's where he was. And so he was trained, if any of the people listening to the show are psychologists, Bill Miller was trained in Rogerian counseling. So the work of Carl Rogers kind of underlies the foundation of motivational interviewing. It's empathy, respect for personal autonomy. It's very non-invasive. So yeah, it started in addiction treatment, but Bill Miller and Carl Rogers, actually, if you know about Carl Rogers, he is a research scientist, and he wanted to test this and see, is this effective? If it's effective, what about it is effective? And so we now have, since the 1980s, decades of this type of research. So with increasing research evidence that motivational interviewing is a very effective approach, originally in addiction treatment, but then people started asking, well, can we use this in healthcare? Can we use this in education? Can we use it in social work or criminal justice? And so it's been now disseminated across many different areas, and that's why we have this wonderful grant to support the training of faculty, so that nursing students can receive this approach, occupational therapy students can receive it, physical therapy students, because almost anywhere you find yourself working with humans, this can be a very useful way of communicating.
Let's talk about that. How did you find yourself involved with the LaGuardia grant, the Title V grant, Connexions to Connexion, and bringing this into as a piece of it? How did that happen?
Well, in the past, I had the wonderful experience of doing some workshops for the Center for Teaching and Learning, where I trained LaGuardia faculty and staff in how to use motivational interviewing for advisement, for student advisement. And so we had kind of previous experience doing that, and some people in health sciences said, we'd really like to offer this more to our students. And so I approached the Center for Teaching and Learning and said, is there a way that we could make this training available, so that not only I train some individual people, but we can prepare them to be like me, which is a trainer. And so is it okay if I tell you a little bit about what we're doing? Is this a good moment for that?
Totally. And, if we don't get through it before the half mark, we're going to keep talking.
Okay.
Second half hour. Yeah, we're going into the deep dive, I guess. Let's go.
It's really, I'm such a dork because I really enjoy not only doing the training, it's like even talking about it. Like, this is something that I just really get excited. So what the current grant is supporting, a very innovative program. It's a year-long training. So in fall one, the health science faculty got trained in motivational interviewing so that they can do this style of communication. During fall two, we did a sort of coaching and booster session where everybody who got trained had to complete recordings, and I then evaluate the recordings with a coding system that kind of marks how well somebody is doing. They had to do that 3 times each, and that every time they did it, we would meet as a group after and do like a group support, so that everybody gets extra practice of their skills. And that helped everybody become very skillful in motivational interviewing. And now here in the spring, what we're doing is we're training them to be trainers. So now they are practicing how to help other people learn this approach. And they're going to take their skills and use it in all of their disciplines. So we have nursing, occupational therapy, physical therapy, we have public health, and human services. So we'll be able to disseminate this approach across all of our health science programs, and importantly, pass it on to our health science students so that they then go into their careers with some of these motivational interviewing skills. And this is considered a micro-credential that the students can earn. It's very desirable in employment settings. If you have this skill on your resume, this motivational interviewing skill, it's something that employers really want to see. So it's very exciting because human service students get this because they take this class as part of their major. But up until now, human service students were the only people who were getting this. And now a lot more students are going to receive this micro credential, and they're going to take these skills, into the field. I'm excited about that because, again, it makes them more employment desirable, which is something that, we all want to see. But even on a greater level, this is going to make people better at helping. So again, if you are a physical therapist and you're working with a client or a patient and they're struggling to do their exercises, this style of communication can help you support that person so that potentially they become more motivated to do the exercises. If you're a nurse and you're working with somebody who isn't always taking their medication, or this person has diabetes, they're not always eating the right type of diet that they're supposed to eat. This can help, this style of communication can help somebody become more motivated to eat a healthier diet or take their medication. So there's potentially a greater public health impact that this grant is really supporting.
All right, it's 1:29. I want to just take an opportunity to just do our station break. The show is What's Going On. I'm your host, Hugo Fernandez, here on LaGuardia Web Radio. And today my guest is a professor in our health sciences department, Dr. Juline Koken. And Dr. Koken is talking to us about motivational interviewing project, which is in conjunction with the college's Project Conexión Title V grant from the U.S. Department of Education. And let me get back to you here. I was thinking it when I was looking for examples of or something to play before the opening and close of the show, and I saw this really bad version of what the person did. I started thinking, wouldn't it have been great if we could have shown somebody, with bad, whatever it is, good interviewing skills. Obviously, we didn't set that up with my engineer, Mr. Pope, who I always drive crazy with these ideas. But I'm wondering, is there some kind of demo we could do? Let's pretend I have an issue. I have plenty of them, and you could do your motivational interviewing technique on me.
Yeah. So
like
if
we did. I'm sorry. I want to talk. I said we'll do it for 3 minutes or something like that, just so people can see you in action.
Yeah.
And
you can role play if you want, or I double dog dare you to just be Hugo Fernandez and be yourself.
Let's talk, because you were talking a little bit about health issues. So let's talk about my weight.
Okay, don't say another word. Save it when we're, yes, perfect. And we'll start right there.
Okay. So now what happens?
Now we just hang out until we're back on air, right?
No, we're on the air now.
Oh, I thought you said we were doing a station break.
I did do, station break just means I tell everybody what they're watching.
Oh, okay, sorry.
That's okay.
I don't do radio. I don't know these things.
Well, you see, this is you're working yourself up for when you will do radio.
Okay. Well, okay. So of course we can do a demonstration. Maybe Christopher can be the timekeeper. You said 3 minutes.
Yes, Mr. Pope, would you give us a 3-minute clock? Okay, he's setting it up. Go. I mean, I'm looking at the thing here, but whatever. I guess you don't want to interrupt me. My thinking. Can we start, Chris? Yeah,
okay.
He's taking a second.
So the question that I was going to lead with was, what's something you've thought about changing, but either you haven't done it at all, or you've done it kind of part way, but not as much as you want. And you mentioned something about your weight. So tell us a little bit about that.
I'm heavier than I've ever been. I barely exercise, except for things around the house I do. And the only time I ever lost weight in the last 10 or so years was when I just stopped eating carbs and stopped eating, period. I mean, micro fasting of sorts. And it's just hard to do. And I feel bad. because I'd like to admit, my wife always talks about the last time I looked good was when I came back from a study abroad trip to Chile 10 years ago.
Ouch. Okay, so
So
you've mentioned a few things, but one of the things that really strikes me is you have had some success with this in the past. There have been times where you changed your diet and you were successful in losing weight, and you've tried other things, the micro fasting that you mentioned, and it sounds like you'd really like to make some type of change here. But what you're thinking is that you don't want to do something so extreme as what happened before. You don't want to stop eating or go on a super restrictive diet.
well, it's hard, to go to the day without eating carbs, and it's the kind of thing where you're always thinking about it. You get, I
Mm-hmm.
mean, until your stomach shrinks, all you're thinking about is food and
Yeah.
wanting to eat, and the kind of things you want to eat, and it's rigorous in the
Mm-hmm.
sense that you can't. You gotta like, because if you start rationalizing, you'll start picking up carbs fast.
Mm-hmm.
You're like, eat bread this time, but I won't tomorrow, and then before you know it, you're back to where you started.
Yeah, absolutely. And so what you're thinking you would like to do is find some way that the diet that you would be eating is healthy, but it's also acceptable to you and it's things that you want to eat so that you're not miserable and thinking about the food that you're being deprived of all the time. And if you were able to find some way of eating that didn't feel so deprivational, but still maybe allowed you to lose a little bit of weight, that would be very happy for you to find.
And I think probably figuring out some way to work some sort of exercise in on a daily basis
Mm-hmm.
wouldn't hurt.
So if you were burning more calories, then you could afford to take a little bit more in as well, and that would give you some breathing room with the diet.
Yeah, I mean, and like again, there's been fits and starts, but
You've been trying.
yeah, but when I look in the mirror, I'm not impressed.
Okay, so you actually, it's because talking about it, I can see how much thinking you've had here. What you're thinking about is
Time.
find.
Been 3 minutes. We ran out of time. So what happened there?
Well, that's what I would ask you, Hugo.
What? Well, it sounded like I just told you about all the things that I've been thinking about with my weight gain and attempts
Mm-hmm.
to lose weight,
Mm-hmm.
and you were being very supportive
Mm-hmm.
and sharing back, positive in a positive way, things I had at least been trying and what I'd like to be doing, and
Mm-hmm.
and uh, get me thinking about it instead of what happens usually is I just get into self-hatred.
Yeah. So
Around weight.
you noticed that it not only got you thinking about it, but it got you thinking about it in a way that was a bit more positive.
Right.
Yeah.
Yeah.
And did you happen to notice how many questions I asked you?
I don't think you asked me almost any. I think
Yeah.
you just once you got going, you just all you do mostly you were mirroring.
Yeah.
You're
So
doing
there
a lot.
was one question at the very beginning when I said this thing that you thought about, tell us about
Right.
that was the only question.
And boom, off I
Mhm.
went.
Yeah. And you did. I mean, this is actually a really great example for us to use because I've had my own issues with, food and things like that as well. And these changes are really hard to make. And so you can really see that it's like, okay, now you recognize this is something you've thought about, you've made attempts, you've tried things, and you start to reflect on all the things that you have done instead of coming at from a place of, feeling bad about yourself.
Yes.
Yeah.
And that's kind of good. Uh, so I was going to say, so with the grant, this is what we're training, and they're using it to train these health students. But you said also that this could be used for things like, for example, advisement.
Mm-hmm.
Yeah, I
Yeah.
was actually thinking how it would apply in the art program when students
Mm-hmm.
are, because critique, even when you say it, it's like it has this negative connotation. Oh, I'm going
Yeah.
to be criticized,
Yeah.
and but again, I could see how this could be used as a way to encourage somebody to you have them talk about their work and then mirror their ideas and encourage them to follow their own nose in a sense. Would that?
Yeah. Yeah.
So where is this going with the grant right now? Where are we with? We're in. I apologize that I don't know. I know we're in a reporting period for the grant because we're doing a showcase, and then in fact pieces of this interview might end up in that showcase where we're going to share it with folks. But where are you in your process with the grant and the trainers? The trainers have been trained and they're training more trainers, right? And so is this kind of, we're just trying to spread it out throughout the college so that everybody's doing this?
I would love that. So we're still in the training the trainers progress, but we're almost done. So the trainers are being trained, and we are already rolling out bits of this with the different classes that students are receiving as part of their, nursing or physical therapy, training. So the trainers are practicing implementing this with their students, both in the professional sense of practice motivational interviewing, so your nursing student can take that into the hospital, but also from an academic success perspective. And I've been having wonderful feedback from the staff and the faculty when they said, I had this student come in and they were very upset, or the student's really struggling in the program, and they practiced their MI skills to support the student in, successful student behaviors, and it worked really well. So we're kind of winning in both senses of giving students a valuable professional skill or micro credential that they can take into the field, and also just supporting students in kind of student success. So using it in advising and things like that.
So now I'm going to put on my my grant giver hat on and ask the question that folks who give out grants always give. So what are my outcomes here? How can you share with me that you have taken my money and run with it and done good things? What you said you're a researcher, and then research is always outcomes. So what are we going to share? Is it all qualitative, or is there going to be some kind of quantitative piece, or how does it work?
There's both. So, and some of this data has already been provided because there was like a halfway reporting period or something. So we can measure how many students have been touched by this training, how many students are enrolled in a program where they're receiving training, how many students got advised, and the motivational interviewing got folded into that. Each program in health sciences is going to do this a little bit differently, but I can speak for within human services. Every student that graduates from our program graduates with this micro skill and takes it into employment. So we can measure some of that. And now, before this grant, human service students were the only students at the college who got that. And now we're disseminating it to the other health science disciplines as well. So you can measure, the vast increase in the number of students that are getting this skill. You can also measure things, and of course we don't have this data yet, but you could measure, is there an improvement in student retention in the program, for example, or other types of positive student outcomes that we might be able to see.
So when you train your trainers and you're trying to give them feedback on how to do this, is it just, how does it work? Is it they just experience it and then they try to duplicate that, or you say to them, okay, whatever you do, just repeat back to them everything they say, but you have to figure out a way to say it positively, right? What are the instructions?
Yeah.
What are the instructions?
Well, actually, you pretty much just said what it is. So there's kind of two ways that people learn this. People learn this through modeling. So when I'm training people in MI, I'm modeling the MI skills myself, meaning instead of giving you a lecture, I'm going to ask you, well, what do you know about how this might work, or how might you try that? And then I will reinforce the aspects of what they give me that are, good or accurate or effective. So it's you use open questions essentially to invite somebody's knowledge, and then you strategically reinforce the effective parts of what they're doing. And then if you want to get super research nerds, so you're gonna have to shut me up in a moment because I can really totally dork out here. There is a research developed instrument called the MIGHTY, or the Motivational Interviewing Treatment Integrity. And it's a way of evaluating what happens in an MI encounter. So that 3 minutes that you and I had, if somebody was tape recording this, I'm trained as a MIGHTY coder, and I can evaluate what was delivered. And then the trainees in the grant get this during that fall 2 coaching that I described. So the MIGHTY gives some very specific feedback. And you can then offer this feedback to somebody, and then they can decide, okay, what would I like to do to improve, or how might I practice this? So yeah, you train people in this by essentially modeling it. And, wasn't it, who was it, Michelangelo, who said like the sculpture is already within the stone? Right. This is the same type of concept. Motivational interviewing isn't something you do to somebody, right? So we invite it to come out of you.
Yeah, exactly. How he would finish that, and obviously we're paraphrasing, is his job was to help it escape, or whatever he said, mm-hmm. Bring it out. Mm-hmm. That's interesting. When you were talking there, and you were talking about the MIGHTY, I started thinking of like a torque wrench, some sort of science. But I'm guessing it's based on the language used. You're measuring positive language versus negative, or
a torque wrench is a pretty good way to describe it. It's so in research, the fancier that you get with something, the less reliable it is. Right. So if the question is, how do I design an instrument that will evaluate motivational interviewing in a very reliable way, then the answer is you want something that's not going to be overly complicated. So the MIGHTY involves counting verbal behaviors. In the 3 minutes that I had with you, it would count, okay, she asked one question, and then it counts the other things that I did, which we would call reflections. Right. And then it kind of measures overall style. How collaborative was this person? How empathic were they? How much did they invite the client to consider changing? If the client described reasons not to change, were they skillful in how they managed that? So when you were reflecting on your 3 minutes that we had, you were saying about how I kind of said positive things to you. The bad version of the conversation would be something like, well, why haven't you done this yet? Or right. Why is this so hard for you?
What's wrong with you?
Yeah, exactly. And so if, the MIGHTY would catch that and say, okay, well, that's confrontational, or that's shaming, so it can measure positive behavior or less positive behavior and provide feedback on it. But it's a highly reliable instrument, and more like a torque wrench than a fabulous machine.
Right. So we're in the last quarter hour, and so this is an opportunity for you to talk about things that you're working on in the future, and or anybody else. If we want to do we can do thank yous and goodbyes as well as part of that before we play some more music. But the grant, where does the grant stand right now? We're in the last year of the grant. Are we gonna? Is there another year? Are we going to reapply? How does that work?
So this is in June that the grant ends, and so what we're hoping to see is continued implementation of motivational interviewing across the health science professions. In terms of the future of the grant, I'm not the person that applied for this grant myself, so I can't say whether or not they're gonna. But what I would like to do is to see some support for continuing to train people across the college, it's not only health science disciplines that can benefit from this. So I am hoping that we will see more of this training being available. And there's another type of training that I am hoping to at some point offer as well, which is training people in being supervisors. Because motivational interviewing is a client facing, but how do you support the people who are supporting the clients? Or in this case, how do you support faculty who are supporting students? Or how do you support supervisors who are supporting faculty? A lot of people, become supervisors or directors because they were good at their jobs and they got promoted.
Right.
But most of the time, they don't actually get trained in how to be a very effective kind of director or manager. And a lot of these communication skills are really helpful for that type of setting.
Yeah, I was thinking that while you were talking about it. I think I said that out loud once at when I went up for full professor. I brought up the fact that we come in as experts in our fields, and they have to teach us how to become teachers in some cases.
Yeah.
Then once we are good at our teaching, at some point you're chosen, either elected or picked to be, like in the case of coordinators, are chosen.
Yeah.
Chairs are elected, but no one, you didn't come in with any supervisory skills. They have to be taught.
Yeah. And, going back to how we learn things, humans, we mainly learn our behaviors by modeling. And so a lot of, how you taught until you knew better was how you were taught. You taught,
Exactly.
And how are you supervising others? Well, you model the behaviors that people did when they were supervising you. And we know that, that can either be very helpful or very unhelpful. So yeah, it's just as we want to support people in becoming better teachers when they come here. It would be great also to support them as they, rise into, management type positions.
Right. It goes back to, there's been talk of mentoring, and it's kind of exciting. There's a lot of exciting things happening. I mean, a few weeks ago we had Dr. Cario on, and Dr. Cohn was on with him, and we were talking about mindfulness, meditation, and so now this is a mindfulness in listening skills, and in again, giving feedback in a sense.
That's a great way of putting it, and it's true.
But the healthy way. That's why it excites me. I haven't been, once you become full professor, sometimes a lot of us move away from the Center for Teaching and Learning, and because we've done a lot of training there. But the center continues to be a place where and what I miss the most is working with colleagues like yourself, who I don't know from other areas.
Yeah.
And getting turned on to these new tools, which when you apply in the room, make a difference, have an impact.
Exactly. It's not just the tools that you learn, it's the relationships that you build as well, with other faculty and staff, people who maybe, you wouldn't have had the chance to get to know before. And, it's why I'm very grateful that we've had this support to do this year-long program. It's an incredible investment in our faculty and staff here. And of course, it's an investment in our students, but and even just on a personal level for the people who are taking part in this, that's a huge investment of their time. Right now, the occupational therapy program is having a site visit. They're getting re-accredited. And in the midst of all of that labor, those staff have still been attending the MI training. And they actually got really positive feedback from their accrediting body that it looked really good for them, that they were doing the motivational interviewing with their students, because that's something in the physical therapy field that people do. So it's really wonderful to see people take these skills and bring it to the work that they do, and of course to our students.
All right. We've got about a little under 4 minutes left, and so I wanted to give you an opportunity to say any last things you wanted to say, or any folks you wanted to thank, or anything you wanted to bring to our attention before we go back to Mr. Taylor.
Yeah. Well, of course, we have to thank the Center for Teaching and Learning and Dean Eric Hoffman and Casey Powers, who took the initiative to use this Project Conexión funding for the benefit of training our faculty and sharing this with our students. So huge thank you to them. And thank you to the people who are participating in this program for all that they've brought to it. And thank you, Hugo, for allowing me to come on the show and nerd out about motivational interviewing, because you can see I really like talking about it.
Well, you're very good at it. It's always interesting to listen to somebody talk about something that they know very well and they're excited about. So that's okay. I don't think of it as nerding out. I think of it as learning something here. I just want to say I want to thank you because you have been supportive to some of the work that we've done here through LaGuardia Web Radio with the Faculty Council and sharing videos that I always think of as some of the best videos that when you play drums out in the streets or you were doing your I don't know exactly what you call that. Is it rope dancing when you
yeah, aerial rope,
aerial rope. So I guess you brought back your ballet skills for that. And again, to some of the better video. I don't know if we'll be doing any more of those pre-recorded events anymore, but I would love to have a live show.
That would be fun. I'll bring my kit. We can set it up in the courtyard by the atrium.
We'll need to get some more folks who are also prepared to do things live. We'll see what's happening. But anyhow, we're almost out of time, and I just want to say thank you to our guest today from our professor from Health Sciences Department, Dr. Juline Koken. And Dr. Koken has been talking to us about motivational interviewing project, which she's been doing in conjunction with the college's Project Conexión Title V grant from the U.S. Department of Education, which specifically is for Hispanic serving institutions. And so I think that's it. Again, that's great for our Hispanic students here. And I also just want to thank the Center for Teaching and Learning, who helped put this show together. Casey Powers, who is finding us folks so we can pre-record and share at the showcase, which Mr. Pope and Jamie Riccio, who is our station manager director, is going to be splicing together for us. So look for that at the end of May 31st. And I just want to thank everybody for watching and listening, and we'll go out the way we came in with some James Taylor. Thanks, and bye.